E-cigarette users face a higher risk of a heart attack. A scientist admits he would not want his family members to vape because of the dangers. Using e-cigarettes raises the risk of heart attacks by a third, researchers have warned. Concerns are growing around the world about the long-term health impact of vaping, amidst booming popularity of the devices. Yet e-cigarettes remain at the heart of public health policy, with officials repeatedly insisting the benefits far outweigh any potential harms. The study, to be presented at the American College of Cardiology conference in New Orleans later this month, is one of the largest ever conducted on the impact of vaping. Experts from the University of Kansas examined data from more than 90,000 e-cigarette users. They found people who vaped every day were 34% more likely than non-e-cigarette users to suffer a heart attack, and those who used the devices more sporadically had a 29% increased risk. Study leader Dr. Mohinder Vindhyal said, "Until now, little has been known about cardiovascular events relative to e-cigarette use. These data are a real wake-up call and should prompt more action and awareness about the dangers of e-cigarettes." He admitted the study was not perfect. Most of the e-cigarette users were ex-smokers, so the heart problems could be due to their lifetime of tobacco use. But he stressed that his team had tried as far as possible to take smoking into account, adding, "I wouldn't want any of my patients nor my family members to vape." Roughly a third of the 90,000 e-cigarette users were also smokers. The team's initial analysis suggested e-cigarette users had a 56% increased risk of heart attack than those who did not vape. But taking into account the fact that people who were also regularly smoking tobacco had a 165% increased heart attack risk, they calculated the increased risk of vaping alone dropped to about 34%. They found e-cigarette users were also 55% more likely to suffer from depression or anxiety. Dr. Vindhyal, however, admitted his team could not completely eradicate the impact of previous tobacco use, because virtually all e-cigarette users in the study had smoked tobacco in the past. Regardless of these caveats, he insisted the findings are concerning and far more research is needed into the risks of e-cigarettes. "We found that regardless of how frequently someone uses e-cigarettes, daily or just on some days, they are still more likely to have a heart attack or coronary artery disease," he said. E-cigarettes contain a liquid form of nicotine that is heated into vapor to be inhaled, avoiding the harm caused by tobacco smoke. Around 3 million adults in Britain have used e-cigarettes in the decade or so that they have been on the market. Public Health England, along with many other health experts in the UK, view e-cigarettes as a crucial tool in the fight against tobacco. E-cigarettes form the core of Public Health England's Stop Smoking strategy, with TV adverts, health campaigns, and researchers championing the technology. But other experts, particularly cardiologists, are concerned about unresolved safety concerns and are particularly worried about their use among young people. Critics have repeatedly warned that the UK is way out of step with the rest of the world in its approach to the devices. The World Health Organization is concerned about cancer-causing chemicals in the devices, and the EU believes e-cigarettes may act as a gateway to tobacco. Last month, the then head of the U.S. Food and Drug Administration, FDA, Scott Gottlieb, said he was so concerned about teenage use of the devices that he is considering the radical step of banning them completely. An editorial in the respected New England Journal of Medicine research last month warned about the concerns among health professionals in the U.S. It warned, while e-cigarettes are safer than traditional cigarettes, they are not without risks. Evidence of effectiveness must be balanced against the short-term and long-term safety of e-cigarettes. A cigarette vapor contains many toxins and exerts potentially adverse biologic effects on human cells. Although toxin levels and biologic effects are generally lower than those of tobacco smoke. Martin Dockrell, in charge of tobacco policy at Public Health England, said last night, "This confirms what PHE has been saying for several years. Vaping isn't risk-free, but it is far less harmful than smoking. It's a no-brainer. Switching to vaping will always be far less harmful than smoking. If you don't smoke, don't start and don't vape. If you do smoke, quit now and consider using an e-cigarette to help you." What is an e-cigarette and how is it different to smoking tobacco? An electronic cigarette, e-cigarette, is a device that allows users to inhale nicotine by heating a vapor from a solution that contains nicotine, propylene and flavorings. As there is no burning involved, there is no smoke like a traditional cigarette. But while they have been branded as carrying a lower risk than cigarettes, an increasing swell of studies is showing health dangers. E-cigarettes do not produce tar or carbon monoxide, but the vapor does contain some harmful chemicals. Nicotine is the highly addictive chemical which makes it difficult for smokers to quit. Nearly 3 million people in Britain use e-cigarettes, and more than 9 million Americans. Types: battery-powered device containing nicotine e-liquid. It vaporizes flavored nicotine liquid. Juul. Very similar to normal e-cigarettes but with sleeker design and a higher concentration of nicotine. Thanks to its nicotine salts, manufacturers claim one pod delivers the amount of nicotine as a pack of cigarettes. It is composed of an e-cigarette, battery and temperature control, and a pod of e-liquid which is inserted at the end. The liquid contains nicotine, chemicals and flavorings. Like other vaping devices, it vaporizes the e-liquid. IQOS by Philip Morris. Pen-shaped, charged like an iPod. It is known as a heat-not-burn smokeless device, heating tobacco but not burning it, at 350 C compared to 600 C as normal cigarettes do. The company claims this method lowers users' exposure to carcinogen from burning tobacco.